Well, good morning and thank you for joining us. My name is Jared Hamlin. I know it says Natasha Cook here. I was having some issues with my Zoom, so I'm using my coworker Zoom today. Just a quick note, this isn't educational only. None of the content provided should be construed to be recommending one program over another. There is absolutely no requirement for you to purchase anything or to participate in the seminar. This is not a solicitation or marketing event, and no salesperson will call you based on your participation in this seminar. And again, as I stated before, if you have any questions during the webinar here, we will be utilizing that chat feature, which again, if you can access that by, if you see your Zoom toolbar, the three dots all the way to the right, and then hover over that and click on chat, and it will bring up the chat bar, and I'll be able to see your chats and respond back. Quick overview of what we're going to be talking about today. We're going to talk about the different enrollment periods for Medicare. We're going to be talking about the 4 different parts of Medicare, as I call it, the alphabet soup. We're going to talk about different Medicare plan offerings, some ideas on how to pick a Medicare plan, and then just some next steps and resources as well. Launched in 1965 and is a federal health insurance program for the aged and disabled. It's administered by CMS, which is the Centers for Medicare and Medicaid Services, and enrollment is done either through the Social Security Administration or the Railroad Retirement Board. To be eligible for Medicare, you have to be 65 years or older. You do have to be a U.S. citizen or a legal resident and must reside in the U.S. for 5 or more consecutive years. There are special situations where people under 65 do qualify for Medicare, things like Lou Gehrig's disease and end-stage renal disease. And also if you have been on disability for 24 consecutive months, on the 25th month, you'll be granted Medicare. There's 2 different types of enrollment into Medicare. The first we're going to talk about is automatic enrollment. And automatic enrollment is for those who are receiving Social Security or Railroad Retirement Board benefits 4 or more months prior to the month of their 65th birthday or the 25th month of disability. Your initial enrollment period package will be mailed to you 3 months prior to the month of your 65th birthday or 3 months prior to the 25th month of receiving disability benefits, and that will include your Medicare card. So if you keep your Medicare card, you're accepting Medicare A and B. If you refuse Part B, you can follow the instructions on the back of your Medicare welcome package. And you would do this in the situation where you might have active employer coverage through yourself or a spouse, or you qualify for some like VA benefits or something where you're not taking Medicare. You're going to carry this card with you when you're away from home. Let your doctors, hospitals, and other healthcare providers see the card when you get it. And if you ever need a new card, you can log in to Medicare.gov and create an account, or you can always call Medicare at 1-800-MEDICARE. So if you aren't receiving Social Security benefits 4 or more months prior to the month of your 65th birthday, you do need to enroll yourself into Medicare, Parts A and B. And you do this by either going to socialsecurity.gov or calling Social Security, or you can make an appointment at your local Social Security office. If you're retired from the Railroad Retirement Board, you will want to contact the RRB office to get started with your Medicare. So now we're going to talk about some of the different enrollment periods for Medicare. So everyone has their initial enrollment period, and that's a 7-month period during which you may enroll in a Medicare plan for the first time. This includes the 3 months prior to the month of your 65th birthday, the full month of your 65th birthday, and the 3 months after your 65th birthday. And so if you enroll in the 3 months prior to your 65th birthday, your coverage is going to start on the first of the month of your 65th birthday. If you enroll during the month of your 65th birthday, it's going to start the first of the following month, and so after. Every year, Medicare has what's called an annual enrollment period, or AEP, that runs from October 15th to December 7th of every year. And this is a period in which you may make changes to your Medicare and or prescription drug coverage. Any changes made during this time frame will go into effect on January 1st of 2020, or January 1st of the following year, excuse me. There's a special enrollment period for Medicare Advantage members, and that runs January 1st to March 31st. And this is the period in which you may switch Medicare Advantage plans to another Medicare Advantage plan or cancel your Medicare Advantage plan and return to original Medicare. There's also a number of other special enrollment periods, include some of the more popular ones are going to be like retirement. If you retire from active employer coverage, that gives you a special enrollment period to join a Medicare plan. If you have a permanent move, that also is a special enrollment period. Or if you qualify for Medicaid, that's another pretty popular one. There's about 26 of them. In total, depending on your situation. So some other enrollment periods are the general enrollment period. So if you miss your initial enrollment period into Medicare, you can enroll during the general enrollment period, and that is every year from January 1st to March 31st. The effective date for that coverage will be July 1st of that year. And because of the late enrollment penalty or late enrollment, you might incur a penalty. And we will talk about that in just a moment. And then again, the special enrollment period is a period during which Medicare recipients may change their Medicare prescription drug coverage outside of the annual enrollment period if they meet certain criteria or have a qualifying event. Example of some qualifying events are moving to a new service area or leaving employer-based coverage. Some Medicare products are only guaranteed issue during your initial enrollment period or when you have a special enrollment period. Just some basic insurance terminology I'm going to go over. So premium, that's the amount you're going to pay for your health insurance coverage. So cost sharing is actually going to kind of bundle these next few into one. So cost sharing is just a general term used to define any amount that you pay out of pocket with your insurance. Deductible is an amount you pay before your coverage level starts. Copayment is a flat dollar amount that you're responsible for a health service like a doctor's appointment or to pick up a prescription. A coinsurance is very like a copayment. Instead of being a flat dollar amount, it's a percentage. And then max out of pocket is the overall maximum you can pay for all cost sharing combined for any category or situation. And then underwriting and guaranteed issue. Underwriting is when a health insurance company evaluates an application's health information when determining health insurance premiums or whether coverage is offered at all. And guaranteed issue, again, means that you are there's no underwriting or pre-existing conditions. You don't have to, the policy is guaranteed to be issued to you. Next, we're going to talk about the ABCDs, or as I call it, the alphabet soup of Medicare. So first is the hospital Part A coverage, and this is going to cover things like inpatient, skilled nursing, home health care, and hospice. Part B is going to cover your medical insurance for outpatient, things like doctor visits, outpatient care, lab service, and durable medical equipment. Part C, also known as Advantage plans, they're going to include Medicare Part A and B, and sometimes include Part D. Medicare Advantage plans are always going to have a maximum out of pocket, and they may offer enhanced benefits like dental, eyewear, and more. And then Part D is pretty easy. That's going to be your outpatient prescription drug coverage. So understanding original Medicare. So now we're going to go over some information. So this is just based on having original Medicare, no other plan to go with it. So you have Medicare Part A, which is the hospital insurance, and there is no annual premium for those who have worked 40 or more quarters in their lifetime. It's automatically provided to those who receive Social Security benefits. If you have worked fewer than 40 quarters in your lifetime, you can still obtain Part A, but there is a premium. In 2021, that premium starts at $471, and that goes down the more quarters you've worked. And all taxpayers contribute to Medicare via their FICA payroll deduction. Things that Part A covers are things like hospital, inpatient care, inpatient mental health, skilled nursing, home health services, and hospice. Some things that are excluded from Part A would be a private room, TV or telephone in your room, long-term nursing or home assisted living services, and custodial care. Now, the private room and the TV in your room, if you're admitted to a hospital and that's what kind of rooms they have, that is paid for. If you are admitted to the hospital and those are an extra benefit, then those would not be covered. Some costs associated with Medicare Part A. So Part A does have a deductible, and that is $1,484 per benefit period, and we'll discuss what a benefit period in just a moment here. And that covers you for the first 60 days of a hospitalization. After 60 days, you do have a copay of $371 per day, and that's for days 61 through 90. At day 90, Medicare actually stops covering inpatient hospitalization. However, you do have 60 what are called lifetime reserve days. So if you're using your lifetime reserve days beyond day 90, that is a $742 per day copay. If you ever exhaust those lifetime maximum days, you are responsible for 100% of all cost. For skilled nursing, the first 20 days are covered at 100%, so no copay. After day 20, day 21 through 100 is covered at a copay of $185.50 per day. And beyond day 100, the member is responsible for all cost. For home health care, there's no copay for up to 365 days of home health care. So benefit period, as I talked about before, measures the inpatient hospital and skilled nursing facility services. That benefit begins the day that you first receive inpatient care or admitted to a skilled nursing facility, and it ends when you have not been in a hospital or skilled nursing facility for 60 consecutive days. So an example of this would be, say you have a heart attack and you go to the hospital and you're in the hospital for 2 weeks. And then you get discharged, and a month later you have another heart attack and you're readmitted at a hospital. Because you haven't met that 60-day time frame, when you go back into the hospital, you actually start at day 15, not day 1. So as we look back at those copays and deductibles, you can see where that comes into play. Now, same situation, say you had a heart attack, you're in the hospital for 14 days, you go home, 3 months later, you have another heart attack or some other thing that you're admitted to the hospital for. You would start back at day 1 because you've met that 60 days. You pay your Part A deductible for each benefit period, and there is no limit to the amount of benefit periods you can have, not in a year, not in a lifetime. So there's no limit to the amount of benefit periods that Medicare allows. Part B medical insurance. So there is a monthly premium for Part B. In 2021, that is $148.50 for most people. It could be higher depending on your income. It's either deducted directly from your Social Security or retirement benefits or your federal retiree payments. Now, if you are not collecting Social Security benefits, they will bill you quarterly for that, or you can set up Medicare Easy Pay deduction from a bank account. As I mentioned before, there is a late enrollment penalty if you do not enroll in Part B when you are first eligible or have a reason for that. So it's a lifetime premium penalty for not signing up when you're eligible. The penalty is 10% for each 12-month period you went without having Medicare Part B when you were eligible and did not have credible coverage. And you pay that as long as you have Part B. Now, there is some limited exceptions to that, like having employer coverage or other credible coverage as good as Medicare. You can sign up during a special enrollment period, and there is usually no penalty if you sign up within 8 months of losing employer coverage. As I mentioned before, some people delay their Part B with no penalty, and they can do this if they're covered under an employer or union health plan. It is based off current employment for you or your spouse. So it does have to be an active plan. It cannot be a retiree plan or a COBRA plan. There's no penalties for those who enroll while you have coverage within 8 months of losing coverage from employment. And you're always going to want to contact your benefits administration for more information about that. The things that Part B covers are going to be things like doctor visits, outpatient services, lab services, preventative care, durable medical equipment, and diagnostic testing. Some things that Medicare Part B does not cover are going to include acupuncture, dental care, cosmetic surgery, hearing aids, healthcare while outside of the U.S., outpatient prescription drugs, that's covered by the Part D portion, routine foot care and routine eye care and eyeglasses, and also most vaccines are covered under Part D, not Part B. Part B does have a deductible of $203 annually, and after that deductible, Medicare has an 80-20 split, so they pay 80 and you're responsible for 20. There generally is no copay for preventative care services, and outpatient mental health also has an 80-20 split. So some things to consider if you're looking at just original Medicare: there is no out-of-pocket protection. So there is no maximum that you can hit to not pay. You pay those co-pays and co-insurances until the year starts over, and then you start over again. There is no maximums. There's no prescription drug coverage. That is kind of a misnomer. I know it's called Medicare Part D, but Medicare actually does not sell Part D or offer Part D. Part D is offered through private channels. There is limited coverage for Part B drugs. Part B drugs are going to be drugs that are administered within a doctor's office, things like infusion therapy, chemotherapy. Those are going to be included in Part D, but most drugs are not going to be included in Part D. There is a deductible for both Part A and B, as I discussed, and then there's a 20% co-insurance that you are responsible for medical services like doctor visits, lab work, and other outpatient services. And a thing to note is doctors and hospitals that accept Medicare agree not to balance bill you for the difference between what Medicare pays and what the plan pays. What that means is if a doctor accepts Medicare and say they bill $1,000 for a service, but Medicare only allows $200 for that service, they cannot bill you more than that $200. Medicare will pay 80% of that and you would pay 20%, but that additional $800 is a write-off to the provider. Some different Medicare coverage options. So the first one we're going to talk about are Advantage plans. And again, as I mentioned before, Advantage plans are going to encompass your Part A and Part B. Advantage plans are always offered by private insurance companies. They're contracted directly with the Centers for Medicare and Medicaid. So Advantage plans are directly contracted with CMS, which is Centers for Medicare and Medicaid. They provide all of your Part A, Part B, and most times Part D benefits all in one plan. There are some plans that are called MA plans that do not include the Part D coverage. Advantage plans are always going to provide max out-of-pocket protection, and they always are going to include everything that Medicare, original Medicare covers, and they may add additional benefits that Medicare does not cover. One thing to note is you cannot have a Medicare supplement policy with an Advantage plan, as Advantage plans replace original Medicare. Part C eligibility: you must have Medicare Parts A and B and continue to pay your Part B premiums. You must live within the planned service area. You must be a citizen and lawfully present in the U.S. You cannot be incarcerated. And to join the plan, you must provide necessary information to the plan, follow the plan's rules, and you can only be enrolled in one plan at a time. Some of the additional benefits that can be included in Part C plans: emergency medical care outside of the U.S., annual hearing exams, annual eyewear and hearing aids, prescription drug coverage, and annual out-of-pocket limits. They can also include things like dental, in-home support and companionship, over-the-counter benefits, rewards and incentives for healthy activities and participation programs, and also gym and fitness memberships. Eligibility for Part D: you must have Medicare Part A and or Part B, to join a Medicare prescription drug plan. So unlike an Advantage plan where you have to have Part A and Part B, for your prescription drug, you only have to have Part A or Part B. Again, with Medicare Advantage, you do have to have Part A and B. You must live within the planned service area. Again, you can't be incarcerated or unlawfully present in the U.S., and you can't live outside of the U.S. You must join the plan to get drug coverage. You are not automatically enrolled in Medicare Part B. So again, as I had stated before, some people think that the Medicare Part D comes directly from Medicare. Medicare Part D is only sold through private channels, so you do have to enroll in a Part D plan. You will not get that from Medicare. There is also a late enrollment penalty for Part D. Part D is optional, but can obviously be valuable for people who take medications. If you do not sign up for Part D when you are first eligible, you might have to pay a late enrollment penalty to decide to enroll at a later date. There are some exceptions, including if you had credible coverage like an employer plan, or if you qualify for extra help. The penalty is 1% of the base beneficiary premium, which is $33.06 in 2021. It works out to about $4 per month for every year that you went without Part D coverage, and that penalty follows you as long as you have Part D. And that penalty can change because the base beneficiary premium can change each year. Some things that Part D covers: medication prescribed by your doctor that you take at home. Most often these prescriptions are filled at a local pharmacy. Generally, these drugs are to treat a specific illness or manage an illness when you have a chronic condition. Things that are excluded from Part D coverage are going to be prescriptions not approved by the FDA, prescriptions sold or used outside of the US, drugs for weight loss or weight gain, drugs for cosmetic reasons, and compound medications. Just some terminology when we're looking at Part D. So a formulary, that's a list of drugs covered by the plan. And each plan is going to have a different formulary, so they're not all created equal. So you can have plans that have drugs on different tiers, a different coverage. So you'll want to always look at the plan's formulary because they do differ from plan to plan. Drug tiers, it's going to be the tier that each drug belongs to, which determines how much you will pay. Usually the higher the tier, the higher the cost. Difference between brand name and generics. Brand name drugs are drugs that are protected by a patent. The drug can only be made and sold by the company that holds that patent. Now, once that patent runs out, other companies can use that active ingredient to make generic prescriptions. All generic prescriptions are always approved by the FDA as having the same active ingredient as the brand name drug, but generally the generic is going to cost less. The pharmacy and then network, the pharmacy options you have for getting your prescription drugs filled at. As far as Part D cost, most likely you will pay a monthly premium, a yearly deductible if applicable, co-payments and co-insurance, and then costs when you're in the coverage gap. And costs can vary by plan, late enrollment penalty, or if you qualify for extra help. So kind of a quick overview on how Part D works. So it's broken down into 4 stages. The first stage is your initial coverage or deductible stage. So if your plan has a deductible, you do have to meet that deductible first. If your plan does not have a deductible or you meet the deductible, you move to stage 2, which is what most of us are used to if we've had employer coverage, where you pay a copay or co-insurance for your prescriptions. Now, this is where it gets a little confusing. So Medicare has set a dollar amount of $4,130. So if you reach a total drug cost of $4,130, and this is a combination of how much you pay for the prescription, either copay, co-insurance, or deductible, and how much the insurance company has paid, if that totals $4,130, you move into what's known as the coverage gap or donut hole. When you're in the coverage gap, you do pay 25% of the cost of all of your medications, and you stay in this coverage gap donut hole until one of 2 things happen. Either you reach a true out-of-pocket cost of $6,550, not including the amount that your plan has paid within the year, or the year starts over and you go back into stage 1. If you do hit that $6,550, you move into what's known as the catastrophic coverage stage, where you pay 5% or a small copay, whichever is greater, and you do this until the year starts over and you would go back to stage 1. So ways to avoid the donut hole: talk to your doctor about switching to lower cost or generic medications, or see if there's over-the-counter medications available for you. Ask your plan about prescription drug mail order programs. If your plan requires you to use network pharmacies, make sure you fill your prescriptions at those pharmacies, because that can always save you money. Extra help. So Medicare provides a program called Extra Help, and you may qualify for extra help if you have limited income or resources. Extra Help is a Medicare program that helps pay for some Medicare prescription drug costs, such as monthly plan premiums, yearly deductibles, co-insurance, co-payments, and coverage gap when you're in the and payments for coverage gaps when you're in the donut hole. Those who qualify are not subject to the coverage gap or late enrollment penalty. And if you do qualify for Extra Help, you have a continuous special enrollment period, meaning that you can change your plan at any time. The changes would take effect the first of the following month. So just to break down some of your choices, so you can go with original Medicare and then add a supplement and a standalone drug plan, or you can go the Advantage route, which is adding a Part C plan, which is going to combine your Medicare Parts A and B, and in most cases D as well. So now to talk about Medicare supplements. So supplements are plans that are standardized and generally do not include enhanced benefits. Medicare supplements, also known as Medigap plans, do not include a network, meaning that with a true supplement, you can see any provider that accepts Medicare. You don't have to stay within a specific network. It does not replace Medicare Parts A and B. It provides coverage for nearly all of the cost sharing and gaps in original Medicare Parts A and B. Does not include prescription drug benefits. And one thing about supplements is the premium are generally what's called age banded, meaning regardless of your health, the premiums are going to increase as you go up. And they can be underwritten if purchased outside of your initial enrollment period, and a special enrollment period does not apply. So just some tips for picking a plan. Obviously, cost is a big one. So you want to look at the premiums, but you also want to look at the other costs associated with those plans, like if there's deductibles or copays, or it provides enhanced benefits, like say a gym membership or things like that. You want to look at both the positive and negative cost. You want to make sure the doctors and hospitals that you want to go to are covered by the plan. You want to make sure your prescriptions are covered by the plan. You want to make sure the plan will cover you if you travel in another state or out of the US. You want to make sure that the coverage for the services you need, like if you'd like the fitness benefit or hearing and vision benefit, you want to make sure the plan will cover that. And then the biggest thing I think is you want to be satisfied with the quality of medical care. So some places to go for answers. You can also always call and talk to a representative at 833-551-0565. Or you can go to wellfirsthealth.com/Medicare and you can fill out the request form for information. Some additional resources are going to be Medicare.gov, which is a great resource. One really nice resource on that is the Medicare Prescription Drug Calculator. Under the Plan Finder section of Medicare.gov, you can actually input all of your prescription drugs, and it'll bring up all the plans that are available in your area and give you an estimated cost for your prescription drugs for the year. Another really good resource for benefit information is SSA.gov, which is Social Security's website. So that is all the information I have for you today. If you have any questions, again, feel free to type them into the chat box. I will leave it open for just a minute. Thank you for being with us today, and I hope it was informative. And like I said, if you have any questions, feel free to reach out or type it in the chat box. I'll leave it open for just a minute here.